This is going to go through a Schroth-based exercise for someone with a 3C, which is going to be a prominence in their thoracic spine on one side with their pelvis shifted to the opposite side. So I'm going to go through it as a right 3C, being that my prominence is going to be in the right thoracic region and my pelvis is going to be shifted slightly to the left. So I'll do my best to mimic it, but it's going to be kind of something along the lines of this, right? So at a counter is where I have someone start with this, so they have something in front of them. What also works really well is you have a dresser with a mirror, so you have that mirror to use to make sure that you're maintaining the right positioning. And you need something that's going to elevate your arm. So if I'm at a counter, anything that's stick-like, I'm going to use this cane to help elevate my left arm. And it's nice if I also have something for my right hand. So I may use like this box of cleaning supplies or any kind of like firm bolster, paper towels, something I can prop my arm up on. And I'm going to go through the corrections or steps of where I want my body to be positioned. So first thing I look at here is I'm going to have this cane or something that I can put my left arm up a little high, because this is going to be my weak side that I'm going to be collapsed a little bit towards. So by elevating my arm, this is going to lengthen or open up this side that's going to be a little bit caved in or collapsed, right? And I'll have my other hand resting on this box of cleaning supplies. So to start off here, I go through these little checkpoints in my mind. So I begin, because I'm going to be prominent on this right side, I'm going to step that foot slightly back, which is going to create a little bit of a downward diagonal traction on my pelvis on that side. And I begin by trying to get my pelvis from being shifted out to the left, and I try and pull it underneath me so I feel like I have even weight through both feet. I want to make sure I'm not in an excessive amount of pelvis shifted forward over my toes or pelvis shift backward over my heels. So I feel like I have somewhat of an equal weight bearing through my feet, toe to heel, and I feel like I'm equally weight bearing right to left. Now I like to do this little drill first in my pelvis where I want people to realize that I have the option of moving this way and I have the option of moving this way. All right, so just so you can see from the side, I'm basically going through a pelvic tilt where I can tip my pelvis forward, and you'll see I kind of puff out my ribs in the front and arch my back, or I can pull my pelvis underneath me, and this pulls my ribs down slightly. So usually I'm looking for, as I set myself up in this position, I want to try and minimize this excessive lordosis or anterior tilt of my pelvis, and I want to see if I can pull my hips underneath me without really overly straining, right? So I may feel like there's slight tension in my lower abdomen, but it's nothing where I'm working very hard to do it, right? So once again, right foot slightly back on my prominent thoracic side, left arm elevated on my weak or collapsed side. And I go through those little equal weight bearing positions and I maintain that tuck on my pelvis. First, maybe establishing the difference between one versus the other, and then seeing if I can maintain my pelvis underneath me. Now here, as I'm looking in the mirror, I want to see that I'm very lightly breathing, trying to breathe by laterally expanding or pushing air to these lateral aspects of my rib cage without seeing my shoulders elevate. So first, I just want to try and maintain this position and posture, trying to think about my head reaching up tall towards the ceiling. I use this hand on the cane to very lightly press down and feel like I'm elongating my trunk and torso, and I'm just breathing normally. Trying to take slow, deep breaths, really working on gradually increasing the depth of my breath into my rib cage on both sides, but I'm just showing you on this side because it's going to be an area where I'm collapsed, right? So I'm really focused, especially if there's a mirror here, on nothing elevating through my shoulder, right? If anything, I'll very lightly keep downward pressure, pulling my shoulders down away from my ears. Just watching that as I press down, that doesn't encourage me to do this. So I set myself up in a good position. We term that the 3D postural correction. I work on this axial decompression and normal gentle breathing. And then I try to gradually increase the depth of my breathing. I'm trying to take deeper breaths, really thinking about expanding through my rib cage. Now the next step is going to be muscle activation. So now I want to see if I can create tension in this position. So one thing I show people to make sure they do is we're going to do it in that exact position, but to feel your ribs, right? And feel how as you take a deep breath in, you should feel your ribs expand, right? So the air passively, to some extent, fills up your concavity or fills up your thoracic region and expands your ribs. Now I want to see if I can maintain that expansion by tensing muscle and keeping some muscle activation by pushing out, right? So basically what I do is, as I inhale and my ribs expand, I see if I can keep that outward expansion even in the absence of that inhale. And by pressing down into some of these external structures, it helps me to create that muscle activation. So coming back to the position that I was in, I do my breath in, and then as I exhale, I'm pressing down into this cane, I'm pressing down into this cleaning supply container, and I'm trying to maintain that outward pressure as I exhale. And then even, if I can, keeping that tension, try and inhale again. And I'll feel that fill up my ribs, and then I'll try and maintain that again, keeping that outward expansion and pressing down as I exhale for about a count of 3 to 4 seconds. And I'm going to try and repeat that little sequence somewhere in the 3 to 4 times, right? Really trying to focus on maintaining that expansion. If I have a parent or someone with me, a friend, a loved one, who can give me a little bit of tactile pressure, especially if this is my collapsed side, and over here in the front, I will also typically be collapsed, opposite my thoracic prominence. I really want to feel that expansion into those two regions, and then as I'm pressing, can I maintain that expansion? And then following that sequence of 3 to 4, then I just want to go back to maintaining my posture, rechecking these basic positions to make sure I haven't started to lose the positioning of my pelvis, that I haven't started to lose the positioning of where my pelvis is over my feet, that I feel like I'm bearing weight equally through both feet, and I'm maintaining good posture, as now I just breathe normally following that activity.